Welcome everyone to Move with Maegen. I'm Dr. Maegen Brady, physical therapist, and this evening I'm super excited to be bringing to you one of my favorite seated sequences. Say that 10 times fast. But I'm asked by patients all the time, what do I do about low back pain? What do I do about neck pain? Especially when I'm sitting and working, or especially when I'm sitting and driving. What are things that I can do to help with these positions? So I am very excited to bring this to you because it is very simple to do. All you need is a chair, even the couch, or even really the car seat, and a safe and stop position would be fine to try some of these in. And they're very effective for really kind of warming up the entire spine. We want to bring blood flow to the muscles around the area. We want to bring kind of that fluid that lubricates between the vertebrae, and just really to kind of warm up into these different positions. So find yourself a comfortable chair and we will get started. We'll start with the feet flat on the ground and a little bit forward in the chair or your seat of choice, so that you're not leaning against the back, you're kind of sitting up tall to begin with. We'll begin with a little bit of 3-part breathing to kind of come into the body and focus on our movement. So you can put one hand on your chest, your breastbone, just kind of above where the rib cage is, and you can put one hand on your belly button, or kind of just like where the lower part of the ribs are. 3-part breathing is first to the upper part of the chest, then to the diaphragm below the ribs, and then into the belly. So we'll start with a deep breath in through the nose into the upper chest, feeling the top hand expand, and then as you exhale through the mouth or the nose, you'll feel that hand retreat. Next is to the diaphragm, underneath the rib cage, breathing in through the nose, moving that air a little bit deeper, and then as you exhale, again feeling that area retreat. The final is down to the belly, so deep breath in through the nose, filling towards the belly button, feeling your hand expand outwards, and then as you exhale through the mouth or nose, you'll feel that hand retreat. We're going to do this twice more through. So deep breath in to the upper part of the chest first, and exhale. Maybe lengthening the inhales a little bit more as we move to the diaphragm. Inhale. That rubber band muscle underneath the rib cage as it drops, and then exhale. That diaphragm, that rooftop retreats back up. And then now into the belly, filling the belly. And exhale. So as you go through that one more time each, through the upper chest, the diaphragm, and the belly, when you're breathing into the upper part of the chest, our upper ribs are starting to kind of move away from the breastbone. And then release. As we breathe into the diaphragm, imagine the handle on a bucket. That's kind of our ribs starting to kind of flare out as you inhale. And then those bucket handles come back down as you exhale. And then the deepest breath right into the belly, breathing in and out. Sweet. Now that we've started with a little bit of intentional breathing, we'll be a little bit more present in the body as we start to move. So again, with the feet flat on the ground, you can put your hands on your knees to kind of give them a comfortable place. We're going to start by kind of rounding forward through the back, allowing the shoulders and the head to drop forward. So we'll come down to a comfortable place, pause, and then slowly, intentionally, we're going to be rolling back up, a little bit of an arch in the back, the chest expands, and we sit up tall. Inhale. And then again, as we roll forwards, we always want a pain-free range of motion as we're kind of dropping the shoulders down, letting the head come forward, never pushing it, but just going to a comfortable stretch in the low back. And then again, as we inhale and roll one vertebrae at a time to a tall seated position, never forcing it, never making yourself dizzy or causing any pain. Nice. So we'll do a few more times with this. As you roll forward, we're thinking from the ground up. So really from your sitting area, the pelvis, that is going to kind of tilt forward like a bowl. It's going to be like showing forward the contents of the bowl, allowing the vertebrae to come forward on top of that. And then that bowl is going to kind of rotate backwards. So now you see kind of the front edge of the bowl, and each vertebrae stacks up on top through the spine. Inhale to get long, and then again, exhale as you round forward, slowly kind of arching or curving the back. And then inhaling to sit up nice and tall. So we'll do a few more of these in each direction. I'll demonstrate from the side view of what this looks like, because sometimes it helps to kind of see the pelvis rotating forward. You're kind of getting that little bit of a rounding through the back, coming forward into almost like a C shape, and then inhaling as you come back up. So let's do maybe one or two more each direction. Inhaling forward, and then inhaling to come up nice and tall. Nice. So now that we've moved a little bit forwards and backwards with the back, a little into flexion and a little into extension, we're going to go into side to side. So sitting up nice and tall in the chair, we're going to slowly use the hands at the sides to reach down towards one direction. Again, pain-free range, just a stretch, pause, and then we're going to inhale as you come back to the middle. Take a moment here to really lengthen through your spine. Imagine like a string is pulling the crown of your head towards the ceiling before we go to the other side. Same thing, so gently tilting downwards. Pause for a moment, and then inhale as you come to the middle, and then exhale as you come to the other side. So the common thing to want to do here is to go very quickly, but we're intentionally slowing it down. We're focusing on creating length through each vertebrae as you come to the middle. And then as we go to the side, we're looking to create that space in the vertebrae on the side we're tilting away from. We're opening up those spaces. And then inhaling to the middle. And how many of these you can do, 10 to 30 is great, but even just 4 or 5, 1 or 2 when you first sit down, if you can kind of get them in throughout the day, or set an alarm on your phone every hour just to move through one of each of these, that's great too. So let's do one more each direction. Inhaling to the middle to get tall, exhaling to the side, and one more, stretching through that opposite side body. And we'll come back to the middle. Nice. So we've done forwards, backwards, the flexion and extension of the spine. We've done side bending left, side bending right, stretching both sides of the body. Next, we're going to do a little bit of rotation. So you can put your hands on your thighs if that's a comfortable place to rest them. To rotate, to turn your body to one side, you can kind of slide your hands on your thighs. You're turning your shoulders, you're twisting a little bit. Again, pain-free range as you pause. And then inhale to come back to the middle. Again, take that moment, take that pause to really lengthen through the crown of the head. And then exhale, like you're wringing a sponge, slowly rotate into one direction. Nice. And then inhale, slowly uncurling back to the middle, lengthen to get tall. And then exhale, like you're twisting from your belly button, open your chest up, keeping up nice and tall. as we do a few more of these on breath, I'll mention that, as we age, our spine typically tends to lose some hydration, less water. Sometimes, especially in us females, we tend to lose bone density. You hear folks with bone density scans finding out they have osteoporosis or osteopenia, the precursor. So as the spine ages, we may be likely to lose certain ranges of motion. We may lose some of this rotation if we don't use it. And again, even just, one or two of these every once in a while throughout the day can really keep the spine mobile. Great. So let's do maybe one more each direction. Rotating, opening through the chest. And one more to the opposite side. Rinsing out, letting all that old stale air come out with the last exhale. And then inhale, brand new fresh air into the middle. All right, there is another motion through the low back that we're going to explore now. So the first few are pretty intuitive. We have, forwards, we have backwards, we have side to side, and we have that rotation in the spine. We also have another range of motion in our low back, and it's a little more complicated, but it's the shoulders coming towards one side. It's kind of like a side glide going in one direction or the other. Another physical therapist and myself, Dr. CJ Mimi, we've tried to brainstorm some fun ways to, liken this to like a boy band dance move, or I tend to think about maybe certain Michael Jackson movies, Thriller, as you're doing this. So it's a little bit different than the other one where we're tilting. It's more of the shoulders coming to the left, inhaling to the middle, lengthen, and then the shoulders coming to the right. Nice. So we'll do a few of these in each direction. Again, always a pain-free range of motion. If this is something kind of new or different, it's just good to breathe into your body. Don't forget. Sometimes we forget when we're focused so much on what we're doing. So keep those inhales coming and those exhales. Let's do maybe one more each way. And last one to the right. Nicely done. All right, so those are some of the smaller ranges of motion that you can take through the back. Another exercise I like to show my patients for kind of reaching towards your toes. Sometimes it's not attainable when standing up. Sometimes it hasn't been that way since kindergarten. Sometimes we lose it over time. But anyone can take a seat in a chair, and making sure that you go really slowly here. The last thing we want to do is get dizzy or stay down there too long, but we want to really slowly bend down between the knees. So inhale to get tall, and then slowly exhale as you allow your body to come down between your knees. We're going to take 5, 4, 3, 2, 1. Exhale, and then inhale to come up. One vertebrae at a time from the pelvis and the hips slowly stacking on top of each other, rolling the shoulder blades back at the top. So just about 5 seconds. We do it for 5 times total to open up those spaces in the low back. That means we'll do about 4 more times here. So inhale to get tall first, and then slowly diving down, maybe using your hands on your thighs if that's comfortable, or just kind of going down straight between the legs. Slowly falling forward as you exhale. 5 seconds here. Allow your head to relax, and then as you come up, inhale. All the way, shoulders maybe loop down and back. Always take a moment, make sure that you're not getting dizzy in either direction. It's so important to drink water throughout the day so that your blood pressure really stays stable when you change positions. We'll do 3 more, all right? So inhaling as you come up tall, slowly exhaling as you come forward. Again, thinking from the pelvis or the hips, one vertebrae kind of folding over at a top like a string of pearls or a string of blocks, letting the head go last. Exhale, and then inhale, slowly sit up. Rolling the shoulder blades back at the top, widening through the chest, pausing for a moment. And again, when you're ready, slowly going down between the knees, creating some space in the low back. As you exhale, maybe you're reaching a little bit farther than before. And then inhaling as you come back up. It's funny because I've heard folks sometimes describe their low back like a block of ice, first thing in the morning. And what we're kind of doing here is we're just chiseling away little bits, maybe taking a little flame here and there just to kind of loosen things up, get it moving. So we'll do one more time, slowly exhaling down between the knees. Always a comfortable range, and then inhale to come all the way up. There you go. Now you can tell folks that you can reach a little bit closer to your toes, taking your legs out of the equation. Next, we'll do a little bit of going back. So you're going to put your arms across your chest. Sometimes having a pillow between your shoulder blades is kind of a really nice little bit of a cushion. This one you can kind of back up into the chair a little bit for. So if you have a back to the chair or maybe your couch cushion, you're going to take your arms across your shoulders. As you inhale, you're going to really lengthen through the spine, sit up nice and tall. And then as you exhale, we're very going to gently come backwards. So just a 3, 2, 1, and then inhale as you come all the way up again. So here we're using the abdominals, we're using the core. Inhale as you come up tall, and then exhale to slowly come back. Extending. Inhale as you come back up. We'll do about 3 more. Again, never any dizziness or pain. This is really just about a little bit of a stretch. Inhale as you come up tall. Exhale as you extend. Inhale to come up. And then exhale as you open through the front of your chest and your throat, extending through the mid-back. Inhale again to come up. And one more time, nice and tall. And then exhaling. Inhale back to the middle, and you can relax your arms down by your sides. Awesome work with the spinal mobility piece. We've worked our way into forwards and backwards. We've worked our way side to side. We've done rotations, and we've done a little bit of side gliding. I would like to finish with 2 stretches that I also love to do to address low back pain when sitting in a chair. The first is grabbing one ankle and drawing it over the opposite knee. You can take one hand on your ankle, you can take the other hand on your knee, and try to really sit up as tall as you can right here. We're going to count to about 30 seconds. So we're never forcing the knee downwards. In fact, if your leg does not like being up this high, it can rest on a stool, and you can kind of hold it there. Coffee table or kind of a low step stool would be great. But if you're able to bring the ankle onto the knee, we're going to take 5 deep breaths. So inhales to lengthen through your spine. Exhales, imagining that knee relaxing down a little bit closer to the ground. Again, inhale to lengthen through the hips and the back. Exhale to create a little bit of space in the leg. So 2 or 3 more deep breaths in and out. And on your next inhale, we'll slowly bring the leg back and rest the foot down on the ground. We'll switch to the other leg, so you can use your inhale to bring the opposite ankle up. Again, never forcing it, never trying to, pull yourself into a position where you can get it up. it's just as good as kind of holding it on the couch or a stool or something like that. But if you can get the ankle on the knee, one hand on the ankle, the other hand on the knee, the real focus here is your tall posture. We're really using that length that we've created in the spine here. So every time you inhale, using that. And every time you exhale, imagining that knee kind of relaxing or letting go a little bit more. Inhales to get tall. Exhales to release. And by the way, that means releasing not just your leg, but seeing if your exhales can relax your shoulders. Are you holding on to any tension in your jaw or your forehead? One more breath in. And let it all go on the next breath out. Nice. Inhaling, we'll bring the leg back down to the ground. So that is one of two stretches that are super simple to do in a chair or with a little bit of an assist from a stool. The second is kicking one leg out straight in front of you. You want to be in a position on the chair where you can really sit up nice and tall, so maybe closer to the edge. So one knee is straight, your heel is down on the ground, and your focus again here is to really bring your chest up and sit up as tall as you can. So your inhales are going to find that length through the spine, and your exhales are imagining the back of that extended leg releasing down towards the ground. Inhales, getting oxygen and blood flow to those hamstrings in the back of the leg. Exhales, trying to turn off your thigh muscles, turn off any muscles that are holding on for dear life. 2 more breaths in and out. Last one, deep in. And on your last one out, slowly slide that heel back underneath you. We're going to switch over to the other side. So extending through the opposite leg. By the way, the right side might feel completely different from the left side. Totally normal. It might feel different if you do this stretch in the morning versus nighttime, or from now to 4 weeks from now if you commit to doing it every day. Things change day to day. The most important thing is that you're able to really breathe into the stretch that you're doing. So let's take about 5 deep breaths here. Inhaling, finding length through the back of the leg and the spine. Exhaling, releasing the back of the extended leg. Inhaling, chest up tall, warrior's bow. Exhaling, trying to let any muscles holding on, let them go. So we'll do 2 more full breath cycles in and out. 1 more in. And 1 more out. Slowly slide that leg back underneath you. Awesome job with those 2 stretches to accompany your spinal mobility. So in a short period of time, you can fit in just as many of those as you want to, listening to your body and breathing into those areas safely. Again, there should never be any pain, discomfort, or dizziness. Nothing like that with any of those. If you do have any of those symptoms, talk to your local physical therapist and definitely have that addressed. We're just going to close with a little bit of the 3-part breathing again. So again, sitting with your feet flat on the ground. Maybe take your opposite hand to your chest this time. Maybe put the opposite hand to the belly. We're going to take 3 rounds of 3-part breathing. So 9 deep breaths. We're going to inhale to the chest first through the nose. And exhale. Relaxing the shoulders, feeling the chest retreat. Inhaling into the diaphragm, that rubber band, just dropping down as you inhale, allowing air to bring into the lungs. As you exhale, releasing that carbon dioxide, feeling that diaphragm kind of return back to its resting position, retreating to the lungs. And then inhaling to the belly button, expanding. Exhaling, feeling your belly button retreat. starting all over again at the chest. We typically breathe into here, so we may be used to it as we inhale and exhale. It takes a little bit more mindfulness, maybe the second two parts, as we inhale to the diaphragm, expand the lungs, and exhale, let the lungs retreat. Inhaling to the belly, exhaling, relaxing the belly, and one more to close off the 3 deepest breaths you've taken all day. Inhale and exhale. Breaths in, breaths out. Final cleansing breath in and breath out. Slowly relax your hands. And I want to thank everyone so much for joining me this evening. It's such a pleasure to be able to move with folks from all over that I may not be able to get to move with normally. I know with quarantine, a lot of our schedules have been completely changed, whether we're able to move more than normal or whether we're kind of stuck at home a little bit more. If you find yourself in a seated position, whether it's kind of in the car waiting, maybe a few little, belly rolls forwards and backwards. If you're having your coffee boil, maybe just a few little rotations just to maintain that mobility. Just kind of sneaking in some of this stuff day to day is going to help maintain that spinal mobility through the long time. One of my yoga instructors says this is the one body we get. It has to carry us through the rest of our life, so we really need to take good care of it. So I want to thank you for joining me and taking good care of yourself. Take care of the others around you as well. Thank you.